The 8 dangers of smoking while pregnant. Smoking affects the woman's body, from hindering blood circulation to rapid skin aging. However, the impact of smoking is increased significantly when you are pregnant. This time around, the dangers not only affect you but your baby as well. When you continue smoking while pregnant, here are some of the risks you may encounter. Miscarriage or stillbirth. Unfortunately, miscarriage is always a possibility when you're pregnant, but the risk is much greater if you smoke. Research suggests that the chemicals found in cigarettes cause complications in the pregnancy, such as slow fetal development or placenta problems, leading to either a miscarriage or a stillbirth. Placental abruption. This is a compilation during pregnancy where your placenta separates from your uterus before the birth of your baby. The amount of nutrients and oxygen that goes to your baby is decreased when you experience placental abruption. As a result, you may experience heavy bleeding, stillbirth, preterm delivery, or infant death. Compared to those who don't smoke, women who do have a high risk of experiencing this condition. Ectopic pregnancy. A study suggests that nicotine in cigarettes causes contractions within the fallopian tubes. When these contractions occur, the embryo cannot pass through the tubes and settle in the uterus. Because of this, the fertilized egg implants itself either in the fallopian tube or the abdomen. Birth defects. Not only does smoking during pregnancy affect your health, but it also increases the risk of delivering a baby with birth defects. Some of the common defects include congenital heart disorders, cleft palate, and respiratory conditions. Low birth weight. Another possible defect is having a small baby. When you smoke, you increase your chances of delivering a baby with low birth weight. In more severe cases, low birth weight can lead to the death of a newborn. As such, it's important to quit smoking during pregnancy. Asthma attacks. When developing infants are exposed to smoke, their lungs will be affected. Because they're still in the developing stage, the smoke can cause irreparable damage to the baby's lungs and alter pulmonary function permanently. As a result, the risk of developing asthma and other respiratory conditions is increased tenfold. Ear infections. Besides respiratory conditions, secondhand smoking can also cause ear infections. Since the eustachian tube connects the nose to the ears, the impact of the smoke as it enters the baby's system can also target the ears. This leads to swelling, pain, infection, fluid production, and interference with pressure equalization in the baby. Sudden infant death syndrome, SIDS. SIDS, also known as sudden infant death syndrome, is a condition described as the sudden and unexplained death of an infant 1 year old or younger. Mothers can reduce the risk of this syndrome by avoiding smoking during and after pregnancy. With these, it's clear to see how smoking can negatively impact your pregnancy. So, to help you quit smoking, you can go to counseling with a gynecologist in Singapore. Beyond quitting, you also need to practice safety measures to limit your exposure to secondhand smoke while pregnant. To ensure your baby's health throughout pregnancy, get pregnancy care and go for regular checkups with a gynecologist.